Hi, I would like to welcome you to the cardiovascular anatomy blog. In this blog, we will dissect the thorax and will extract and examine all the thoracic viscera such as pericardium, heart, lungs and esophagus. The set of lessons you see on canvas is designed to navigate you through the anatomy of the thoracic wall, thoracic cavity and mediastinum. Today we are going to talk about the features of the thoracic wall. We'll discuss the arrangement of the rib cage, the muscles we have here, and the neurovasculature of the thorax. Let's begin. The thorax is the upper part of the trunk. It contains of an external musculoskeletal wall called the thoracic wall and a space inside the thoracic cavity that houses the primary organs of respiratory and cardiovascular systems. Inferiorly, thorax is separated from the abdominal cavity by the diaphragm. Superiorly, it communicates with the neck and upper limbs. The main function of the thorax is to house and protect the heart, lungs, and upper abdominal organs. The protective function of the thoracic wall is combined with mobility to accommodate volume changes during the respiration. These two dissimilar functions, protection and flexibility, are accomplished by the unique anatomical arrangement of this region, and we are going to study it today. The skeleton of the thorax is called a rib cage. It consists of 12 thoracic vertebrae with IV discs, 12 pairs of ribs with costal cartilages, and the sternum. These bones articulate with each other and they form irregularly shaped osteocartilaginous cylinder that has narrower superior and anteroposterior diameters. The rib cage has a superior and inferior thoracic apertures. The superior one is bounded by the first thoracic vertebral body posteriorly, the medial border of the first rib on each side, and by the superior border of the manubrium of sternum anteriorly. It slopes down and forwards so that the apex of the lung extends upward into the neck behind the anterior end of the first rib. And as you see, it opens into the neck and allows passage of vessels to the head and to the upper limb. The superior thoracic aperture is also thoracic thoracic outlet because of that. If vessels and nerves passing through the superior thoracic aperture are compressed, the thoracic outlet syndrome develops. The broad inferior thoracic aperture is limited posteriorly by the 12th thoracic vertebral body, posterolaterally by the 12th and 11th ribs, and anteriorly by cartilages of the lower ribs and by the xiphoid process of the sternum. The inferior thoracic aperture is closed by the diaphragm, as I said. The sternum is a flat bone composed of the manubrium, body, and xiphoid process. The manubrium articulates with the body at the sternal angle, known as angle of Lewis. This joint is a secondary cartilaginous joint, and it possesses a fibrocartilaginous intervening disc. We can palpate the sternal angle that makes it important clinical landmark, showing the level of attachment of the second rib and the localization of the transverse thoracic plane, a plane which runs through the sternal angle anteriorly and AV disc between the 4th and 5th thoracic vertebra posteriorly. The lateral superior border of the sternum has 3 notches: the jugular notch superiorly, this is the place where the jugular venous arch comes close to the bone, 2 clavicular notches on both sides for articulation with the clavicles, and 2 costal notches for articulation with the first ribs. The body of sternum is a flat, elongated bone approximately 20 centimeters in length. It also has some costal notches on the lateral sides, which articulate with the cartilages of the true ribs. The sternal body is often used for bone marrow needle biopsy because of its breadth and subcutaneous position. The xiphoid process is a thin bony projection inferiorly here. It articulates with the body of the sternum at the occipitsternal joint, and this one is also the secondary cartilaginous one. The xiphoid process is an important anatomical landmark, and it shows us the localization of the pericardium and heart. It is commonly identified prior to any indirect manipulations on the pericardial bag. Now let's look at a rib. It's a long bone with a head, neck, and flattened shaft. The head has two facets, one for the vertebral body above and one for the vertebral body below. Two facets. The heads of the first 12 and 11th ribs articulate with body of a single vertebra, and they have just one facet. This fact makes them atypical, and we will look at them a bit later. The neck is the narrow portion of the rib between the head and tubercle, which is this projection right here. The tubercle is a prominence on the external surface of the rib here. It contains a medial facet that articulates with the transverse process of the numerically corresponding vertebra. The flat shaft follows the tubercle. It is thin and twisted on its long axis. The shaft bends anteriorly at the angle of the rib. This angle marks the lateral limit for the attachment of the deep back muscles to the ribs. The inferior border contains a groove. This groove is called the costal groove. You can see it here. And costal groove, it protects the neurovascular bundle which runs here. In order from superior to inferior, we have the intercostal vein, intercostal artery, and nerve. You can use the mnemonic device VAN, VAN, to memorize the order. Compared to a typical rib, the first rib is short and thick, and it has a single articular facet for the costovertebral joint. As you see, it is flattened from top to bottom. The first rib has all general features such as head, neck, shaft, tubercle, but it lacks the discrete angle, as you see. Along its inner border, the shaft features a tubercle called the scalene tubercle, right here. The anterior scalene muscle attaches here. Two shallow grooves run medial and lateral to this tubercle. The first indicates the localization of the subclavian vein, while the second belongs to the subclavian artery. There is no costal groove on its inner surface, as you see. It's just flat. The 11th and 12th ribs have a single facet on their heads for articulation with the bodies of the 11th and 12th thoracic vertebra. And these two ribs, they feature a short neck, no tubercle, and they lack the costal groove and they lack the angle as well. The pointed anterior ends of the 11th and 12th ribs are coated with costal cartilages. The inner surface of these ribs, covered by intercostal muscles, provides protection to the right and left kidney, which lie just inside. So, the heads of the ribs articulate with the bodies of vertebra at the costovertebral joints. The tubercles of the ribs articulate with the facets on the transverse processes of the vertebra at the costa transverse joints. The anterior end of each rib articulate with its cartilage at costa-chondral joints. Those, by the way, are primarily cartilaginous ones. And the costal cartilages articulate with the sternum or with the cartilage above at the synovial, sternocostal, and interchondral joints, respectively. Here we have some differences, as you see. which underlie the anatomical classification of ribs. The costal cartilages of the first 7 pairs of ribs articulate directly with the sternum, and we call them the true ribs. The costal cartilages of the 8th to 10th ribs articulate with the suprajacent cartilages, and we call them the false ribs. The conjoined cartilages of the false ribs, they maintain the costal margin of the rib cage. The 11th and 12th ribs are free at their anterior ends, and we call them floating ribs. It is popular among models to remove these 2 ribs completely in order to give a thinner waist. Just a funny fact from celebrities' life. You have probably noticed that we have a lot of joints and cartilages in the rib cage. Such structure is necessary for high mobility of this part of our skeleton. The ribs, they get elevated and depressed during each respiratory movement. The intercostal muscles, which fill the spaces between the ribs, and the diaphragm, of course, they facilitate these movements. Now take a minute for the questions below the video, and we will discuss the muscles of respiration next.